But today we will see about short notes which we will use to ask in the neurosurgery, especially in general surgical final year examination. So short notes. The first is normal pressure hydrocephalus. So the introduction, the normal pressure hydrocephalus is one of the reversible cause of dementia. Okay. So general about CSF, the total volume of CSF present in the brain is about 150 ml, and the definition for hydrocephalus is refers to increase in CSF volume with ventricular enlargement with the symptoms of raised ICP. So the normal pressure hydrocephalus is one of the reversible cause of dementia. The etiology for NPH. So most common it is idiopathic, and it will also occur in the context of previous brain insults such as supracranial hemorrhage, head injury, meningitis and tumors. The pathophysiology and clinical feature of NPH. The clinical feature, the patient present with a triad of gait disturbances, incontinence and cognitive decline. Okay. So remember as mnemonic GUD. Okay. So gait disturbance, U especially urinary incontinence, and D is dementia. It's a classical triad of NPH. So what is the pathophysiology behind the NPH? The CSF pressure during lumbar puncture is usually normal in the NPH. That is why it's called NPH. But the pathophysiology is believed that because of the reduced brain compliance, okay, is giving rise to the transient spikes of intracranial pressure. Okay, that will cause this clinical deterioration. Okay, so the CSF pressure is already normal only. So because of this reduced brain compliance, there is a rise in the ICP. Okay, so that there is a clinical deterioration in these patients. It will give to the classical triad of gait disturbances, urinary incontinence and dementia. Okay. So let's come to the diagnosis. Okay. The CT always shows the features of the hydrocephalus. Ventriculomegaly will be present, but the main diagnostic clinch in these patients is lumbar puncture. Okay, lumbar puncture, lumbar studies. So it will demonstrate the reduced compliance and it will clinically the patient will improve after CSF drainage. Okay. So treatment. Let's come to the treatment. The treatment, the mainstay of treatment for this patient, once it's diagnosed is give a surgery VP shunt, ventriculoperitoneal shunt. That's normal pressure hydrocephalus. Let's revise. It's the reversible cause of dementia. Most common it is idiopathic, and the pathophysiology behind is reduced brain complaints that causes a rise in ICP. It's a classical triad of gait disturbances, urinary incontinence and dementia. And the main diagnostic importance is on lumbar puncture and seeing the lumbar pressure, and there is a clinical improvement with the lumbar CSF drainage, and mainstay of treatment is VP shunt. Let's go to the next question. Idiopathic intracranial hypertension. So the idiopathic intracranial hypertension is defined as is a raised ICP. Okay, the condition is raised ICP without an underlying mass lesion. Okay, without a mass lesion, the patient having raised ICP. That's gave the scenario of IIH, idiopathic intracranial hypertension. So, what are the clinical feature of this patient? Classically, the patient present with the age of young woman. Okay, young woman who is overweight. Okay, young overweight woman. The patient present with high pressure headaches. Okay, and visual deterioration, papilledema, and occasionally the patient will present with the cranial nerve palsies. Okay. So the pathophysiology behind this IIH is the raised intracranial pressure, which is present in the obese patients, or sinus thrombosis, okay, which occurs. It will cause raised ICP. Okay, raised ICP by giving raised venous pressure.